You can see that we have a panelist before you, and what that panel is going to be doing is listening to the reports that are coming from the various groups that have had an opportunity to meet. And so we intend to do it in kind of a rapid fire session. Then we'll wrap it up with having the responses from the panel. And let me just say this to you beforehand. The panel is there. We made sure it was a diverse panel. It doesn't mean that everybody is going to speak, because they may not feel compelled to say something. So just know that it's not there. They're not there because everyone is going to go down the line responding. So without further ado here, we're going to start with Waterbury.
Yes.
Thank you.
We had a small, lively, passionate group over at Waterbury. So the top three themes that we came up with was improving visitation, arrest protocol, and then also child support issues, and also we combined child support issues and also family support for caregivers. And so improving visitation, our specific recommendation and policy was really creating a more comfortable environment for children to visit, and we thought this could be easily done by murals. Also, the use of video conferencing, which is some technology that was alluded to as part of the panel presentation. And then also one of the other things we talked about in terms of visitation was the issue around correctional culture. So training for staff just around issues around having a parent that's incarcerated and what that means for the culture of the facility. And around arrest protocol, some of the specific things we talked about really favor that of the New Haven project that is underway around arrest protocol when someone is arrested and there's a social worker there that is able to provide crisis intervention and also follow-up intervention for children who might be there during arrests. And the last but not least is the support for caregivers and child support enforcement. And our specific recommendations was around family impact statements, having families be able to give an impact statement to the court. And this came out of, we had a couple of people at our table, Magistrate Whitby and also someone from the Public Defender's Office, talk about crimes that would be better served through probation because maybe dad was also providing child care for mom, and with dad arrested, now not able to provide child care, mom's not able to work, and how that really impacts children along those lines. Also around the issue of the problem-solving court that is now underway in New Haven, just replicating that throughout the state and how it addresses not just the won't pays, but really addresses the can't pays and being able to help them address some of those issues that is preventing them from paying child support. And then last but not least, educating regarding the court process for custody. One of the things that was brought to at our table was the issue of men not feeling comfortable going to court around visitation issues and how that impacts their children. So that's what we got out of Waterbury. Thank you.
We got Hartford coming up next.
I created a fan base. Okay, our three areas that we identified was research and data being number one. And the reasoning behind that is the recognition that if we're not aware of the challenges and the individuals that's in the system, then it's difficult for us to do things or create specific recommendations and policies in order to address those needs. Number two was coordination among the systems. We had a pretty fruitful conversation on that topic with representation from CSSD, DOC, and actually CSSD in the room, along with several community organizations. And that there are many opportunities to continue to coordinate and collaborate in the services that we provide. And from a specific standpoint, trainings and program coordination is a critical piece of that. Our third theme was the issue of over-incarceration, recognizing that the numbers in the system have increased tremendously, and to that end, the kids of individuals who are parents who are incarcerated have also increased tremendously. And therefore, there's a significant need to start to focus on the fact that these kids need specific services, including trauma services and a general recognition that these kids have special needs that should be addressed. That was it from Hartford.
New Britain is up next.
Thanks, Maureen, for that eloquent presentation. You scared Chauncey away. Please know that. He said, I can't follow that. I had the New Britain group, and they had a very spirited discussion. And interestingly enough, we had a couple of people in the group who have been incarcerated, and we have one who's headed into incarceration and is grappling with the issue of visitation with their kids. The three priority areas in terms of the themes that they agreed upon were over-incarceration. They viewed that as an issue, particularly in the area of sentencing reform relative to disparity and drug crimes. They also felt that there was a need to collect more data and conduct more research, that we can't begin to address the issue unless we know the extent of it and what some of the problems are. So that was pretty important. And in terms of collecting data and collecting information, the feeling was when an offender goes into DOC, it's a very good time to begin that relationship of collecting critical information up front and figuring out whether or not maybe a parent, a person who's incarcerated might need some sort of advocacy relative to their situation with their kids. So something like a parent resource advocate would be appropriate to kind of bridge the gap or resolve any conflicts that might exist as parents grapple with the relationship they're going to have with their kids while they're incarcerated. The other big issue in our group had to do with support for caregivers, and that was extremely important. We had a young man in our group who shared that his experience was both his father was incarcerated and his mother was addicted to substances, but fortunately for him, he had two grandparents who stepped in, became his parents per se, and they relied on community resources to keep him involved and keep him, connected to positive activities in the community. And the group expressed some concern about this kind of overuse of visiting parents because in some instances it could be harmful to the kids. So a lot of strategies along the lines of ensuring that there is no harm, making sure that information is shared across systems, that we don't talk to each other. The women in the group who had experienced incarceration felt like the waiting room environment was too sterile and not family friendly with respect to children coming into the facilities to visit. There also was an interesting conversation about the telephone situation within DOC. Someone in judicial shared that in detention centers they don't charge the offenders to communicate with their loved ones, whereas in DOC, particular vendor gets a contract and the monies go back to other things. And the feeling was, rather than it be a for-profit entity, if that money could be put into programs to help those families who pretty much have paid those costs, so that those individuals, those children can travel to facilities and have better, improved relationships with their parents. But overall, I think that the group conversation was very spirited. The sense is that people want to continue the dialogue. And Chauncey, you did well.
All right, New Haven. So this is going to be pretty quick because Joyce, Maureen, and Trevor basically summed a lot of things that we did. So one of the things that we did talk about, and we talked about all the various themes except for the last one, which is mass incarceration. Enhanced services that support shared parenting, so to really look at the family strengthening model as a way to support individuals who are impacted by incarceration. Communication between agencies, no surprise, everyone knows that's something that we need to work on. A policy that requires state agencies share info through universal release because it allows for people to work effectively. Engage the commission that sets guidelines for support enforcement to review and to redefine policies that are family friendly. Suggestion that was made as well. Sort of the theme for us was pragmatic solutions that can be implemented today and increasing family awareness of increasing families' awareness of resources available, and that's about it.
Meriden. Actually, I'm going to keep the choices and recommendations fairly brief so that we can utilize the opportunity of having these wonderfully supportive legislators in our presence. For the Meriden Group, we did have a unique situation in terms of the fact that CJTS is located in Middletown, and we're included in our group. So our group, the discussion in our group was certainly more, I'd say, more geared towards the individuals in the room rather than a geographic determination. With that said, briefly, our three recommendations, our first priority would be number 3, the coordination between system information sharing, identifying specifically consistency and consistency as a key component. Our second recommendation would be number 6, the arrest protocol. Again, given the dynamics of the individuals in the room, arrest protocol, minimizing trauma, and we identified key components as consistency and training in this area. And our third recommendation would be number 1, improving visitation, and we certainly wanted to assure that the focus remained on respecting the individuality of each individual situation. With that being said, in terms of legislative recommendations overall, the group, in terms of looking at the over-incarceration and disproportionate minority contact, would make the recommendation for the legislature to explore available data that's related to decriminalization of marijuana and low-level offenses. Second, we would look to, in terms of increasing overall consistency, we would look to create liaisons specifically to each area around reunification for the families. Third, we would support legislature that strengthens opportunities for reentry services. Full disclosure, I work for the Connecticut Association of Nonprofits. And fourth, increased opportunities, and I believe this was mentioned earlier, to utilize technology, which has certainly increased in recent efforts by the legislature, and certainly CSSD and DOC are doing their very best to walk along that path. So that's pretty much it.
Thank you. New London.
Thanks, Andrew. I had a great group, and that hour and a half just flew by. We had 3 main themes that we centered on, and one was coordination of information throughout the systems. And I want to reiterate something I heard from the other group, and that's a standardized information release form that could possibly eliminate a lot of red tape and people holding on to information. Theme of visitation, and there's a few catch-22s in our system. One of them just happens to be if you're a youthful offender on probation, that you can't visit a parent that's already incarcerated, that it takes some act of Congress or something before you can get in the door. Maybe we can work on that and a policy to allow reasonable visits if they're nonviolent offenders. And transportation was a big issue. A lot of places don't have public transportation. It's very hard for families to visit. And the other one was over-incarceration, and we talked about the idea of focusing the incarceration on meaningful programs and trying to help pinpoint the areas or the issues with the inmates versus longevity of sentencing. Thank you very much.
Thank you, Joe. Megan, from the other category. And just a reminder from the panelists that may not know, the other category is towns that have less than 100 residents incarcerated as their town of residence when they went into DOC.
So our first task as the other category was to define other a little bit more and to look at the problems that children with incarcerated parents who might live in rural or more remote areas might encounter. So transportation came up as a huge barrier. In our discussion, we also, there's a resounding agreement that coordination between systems and information sharing was the #1 issue to be addressed. specifically because of perhaps a lack of resources in a rural area, and also a lack of identifying existing resources that could be used to help children with an incarcerated parent, even if that is not their specific intent or their specific mission statement. One of the recommendations we had was to expand upon the reentry roundtable idea, to bring people to the table to discuss this issue in rural areas, and also in doing that, thinking very broadly, so not just organizations and systems that work directly with incarceration, but also other community organizations, faith-based organizations that might already be in place that could help with this population. One system that is already in place would be schools, especially in a rural area with few other services. A school could be a nice center for information sharing. So talked about support for caregivers, but that would be helped with the increased coordination of services and also continuity of care. So cross-training between different agencies to share information, to share perspective, and to move away from some of the fear that a lot of agencies and a lot of people have about talking about this issue. Because in a rural area, there might be increased stigma, there might be decreased communication.
And I believe, last but not least, we have Bridgeport.
Okay, we had a marvelous group and a lot of good discussion. We voted, as you asked, on the priorities. And the top three for us of the 7 or so that were listed were, number one, by a long shot, were improving visitation, which we have some good examples of actually best practices to share also. A close second was coordinating information sharing among the various systems, but our group added support enforcement services to the systems that needed to be sharing information. So that was another clear winner with most of the votes. Third was support for caregivers in the community in terms of financial and emotional support, the community people who are taking care of children while their other parent is incarcerated. We also, though, when it came back to over-incarceration, there was kind of a consensus among the group, well, of course, that's so huge. We didn't actually vote on it as one of our top three because it was just recognized as such an overarching need. We had a couple of other points that I think might be useful to the larger group. The consensus as we talked about various programs that we all operate was, if you build it, they will come. We all know in this room, we know what good programming is. We know what these kids need. We know they need a safe place that they can talk about things. We know that kids need both their parents. We know that kids need to feel good about both of their parents. So we kind of came away with a little takeaway in Bridgeport that we're going to attempt to make contact with the middle schools and the high schools and try to create some kind of center where we can, the community groups who are present are willing to work and provide some staffing, provide some resources to provide a space for that to start happening. We also talked about the need to market our services and to raise awareness in the general public about these issues, about the interconnectedness, about the impact of kids in prison to the general public who's voting for their legislators, who's supporting these policies, and the resources that are going to be needed. We also talked a little bit about the need for and dangers of information. We talked a little bit about needing a list, or how would we get a list of every child in the public schools whose parents might be incarcerated. But then we thought, well, geez, do we really need that? Is that really what we need? And are there dangers also of such a list occurring or existing someplace? And we just want to be mindful of that as we move along in our data collection, that as the speaker said this morning, there's a certain amount of information you need, and then there's a certain amount of what you already know, and you don't need to necessarily nail every little thing down. In terms of visitation, and if you build it, they will come having services, one of our panelists was a mom who has subsequently had to go because she took time off of work not getting paid to come here. But she's a mom who Dan Braccio got to come here, and she was incarcerated for several years while her kids were little. Her kids are in high school now. And she spoke of the fact that when she became incarcerated, it became very hard to advocate as a parent for her kids in school. So we had a Board of Ed member who also works for probation at our group, and she was very informative in terms of what they're able to do. But it became clear that once people are incarcerated, they still need to be parents, and they need support in order to do that. And the public schools could, probably have a big hand in terms of sending them information, continually including them. It's very difficult for them, and that was very clear. She also talked about a banquet that she attended while she was incarcerated, put on by Families in Crisis at one point. And women at York were invited to go and attend with their kids. This was several years ago, but Tracy talks about it as being so pivotal in terms of her connection with her kids, because it's so hard to create that and maintain that. And she said that everybody who went attended it, had a great time, and it really served as the basis for her to, create and start building what is today a really positive relationship with her kids. So she said, I haven't heard of one since. And she said people who weren't able to attend the banquet, who were incarcerated, wanted to go afterwards. So that just struck me as a great small example of how systems can do the work that we know needs to be done. So Bridgeport, as usual, was a great group. We all introduced ourselves. We hopefully will increase roundtable participation. It was a wonderful group. Thanks.
Great, thank you, and I'd like to thank all of the facilitators and everybody that's participated in the dialogues. It's important, and I like what Bridgeport was just saying about they already have steps for what they want to do. They don't wait for the train to get going. They hop right on, and we appreciate that. But we also want to say, as the Institute for Municipal and Regional Policy, that we're here to help facilitate any of those groups that got together that want to work on next steps. We're going to have this information that we put together in this PowerPoint available on our website, and we'll email folks out who gave us their contact information. We'll also have Ann's Atlas Estrin's PowerPoint available, and we're going to do something with the video that we'll have available as well.